Just doing basic nail care, and we're trimming, and every time I grab a piece here, I want to make sure I'm not cutting skin down here. So I want to contribute this area, trimming this little area. And you can see the curvature of the nail, so you have to get in at an angle and trim that. And as you do it, you have to be careful that you're not cutting the hyponychium in this area. So if we get it close enough, that's where we stop and we come back with an electric file. So we're going to do the same here. Now, again, if you grab too much nail, you're actually squeezing a curved area in two flat areas here. So that can hurt. So you want to take a smaller bite right back here and then come up here and trim the other part of the curvature, putting a finger over it each time to prevent it from hitting you in the face. So we do small steps and we trim it back. We get it short but not too short. We make sure that the corners are not sticking into the skin on the medial and lateral nail borders. We want to make sure that we don't try to cut too much at once. We come back here and grab a small piece, and we just go around the curvature of the nail. And remember, most nails have a natural curvature. Now, some of those become very, very aggressive, and you have to be even more careful in how you're trimming them. You don't want to get the hyponychium, but you want to make sure that you don't leave too much nail. Here's the spicule that we have to get that's still left, and we want to be sure that we're not causing too much problems there. A lot of this material will come off either with a finger or with a file. Again, we've already trimmed this nail earlier, so we're going to now move this apparatus to the other foot, and we're going to bring it over here, and you can see how much more visualization that you have with this device. And we're going to trim this starting here at the corner, and we're going to safely and smartly trim this. And if this gets too close to your hands, you just move it back a little bit. You can see the dust that we created just from trimming without even filing. So those are things that you would inhale if you don't have a mask on, or you can see that some of this is picked up by this filtration system. So we want to make sure we don't have too much of a sharp edge. So we come down here and grab that. We want to get this even straight across, unless they have some very thick nails. So we don't want a real long overhang. You can see approximately where we're trimming it from, and leaving a little bit of margin so we don't interrupt the hyponychium. There is some material that is collected underneath here. Sometimes it's a removable like this, and sometimes, you remember, the nails are laminar, so certain layers of it could be shedded off, and we want to make sure that your points don't dig in too deep to skin right here. And we're going to come back and sand all this down, and again, you can see the groove where the nail has fit right down in here, and you can see it a whole lot better with this device than you can with any other product that I've ever used in the past. The Aerovax just has a superior lighting system that's maneuverable and very helpful to prevent dust from getting up to me by going this direction, and providing all this lighting and all this filtration. So we're almost through with the trimming, and we're just going to be careful. Every cut is a potential injury if you're not careful. These are exceptionally sharp disposable nippers, and we want to make sure that we don't have any injury. Now, we're going to use a diamond bit with this particular file system. We'll put it in. These are sterilized, not just disinfected, but they're sterilized with an autoclave. They're sealed, And you can see that this is attached to there. We turn this on. We use our remote control to turn this device on. And now it's ready to start servicing. Even with all of this apparatus, some dust may get by, so you always need to be wearing a mask if you're going to do this kind of service. Now, even with what I've done, you can still see a little dirt. So we use a curette with a 2mm bevel, and you can bring that out as part of the service. And you don't want to push too far in and injure, but you can see how much that cleans out just by a simple curette. You want to do that with all of these. Now, in many cases, until you get experience, you need to use this first to find out where this hyponychium is, because sometimes that is confusing. And as you bring this part out, you might find that you need to nip off a little bit extra in those corners for in a medical professional office. So again, we're sanding this down. We don't want it rough and potentially cutting. You've still got callus right down underneath here. We're going to be coming up and cleaning this up in just a second. And we're going to go back here and take care of the rest of these. Now you can see a little line where the free edge of the nail is. We're just lightly touching this. And we just want to remove any of the rough edges that could grab a sock and pull this back. Alright, so we will be sure that we checked in between here. And you can see there's a little bit of material that you need to be, we're going to use hypochlorous acid here in just a second. This one's still a little sharp when I rub my thumb over this area. So what I'm going to do is trim that back just a tad more and rub my finger. I rub them over every single nail to make sure there's no dragging with this material against the nail. And then any area I've trimmed, I'm going to come back and sand. Now, basically we're done with this, but we have to follow up with our service. And what we're going to do here is turn off this unit right here. We're still using the light from this to help illuminate our area or work area. But I live and breathe with this Clean Republic, which is a hypochlorous acid, and I use a 3x3 pad after every one of these services, because every time you trim, you can create what's called salon microtrauma. It's a term I came up with in 2006. And what we do is we clean the nail with something that you would normally think is only for surfaces. This is so safe that we use it directly on the skin. I can use it to clean even my face with it. You can actually even gargle with this. Now, if you look here, obviously we've got other dirt concerns, so we want to clean all that out, wipe it down, and if you need to get another pad, that's sometimes, you know, people going barefoot, that's what you're going to see. You don't want to get this inside of a wound. So we're going to come back, get another 4x4. We're going to put this on every toenail, make sure that that is cleaned up. Now this has gotten inside the medial and lateral nail grooves of the nail, and it's cleaned those with actually a sporicidal agent. And you normally can't put a sporicidal on skin. This is the only one I've seen in 25 years that you can. And so we want to clean out in between those toe spaces with flossing with this product. And we want to come back and look to see if there's anything that we see that is a problem. sometimes you can see a little redness right in this area, and that might be a telltale sign of an athlete's foot problem. We want to make sure that we clean all of this out. We want to get all of this off her foot. And again, this what would be normally potentially in between toes. One of the other steps that I always do, especially with our high risk or diabetic patients, is I always take an antibiotic ointment and I put it on my gloves and I rub it into all of the nails. Now you can do this with a nail oil, or if you're doing it in the doctor's office, you can do it with this antibiotic. This is bacitracin. And we rub all of those corners, because anywhere where you trim, you can potentially have created a wound. Between the hypochlorous acid and this product, we're now finished with our service.